In this video, I'll share why practicing squats with a band around your legs is not doing what you think it is. If you've been practicing squats or a sit-to-stand type motion with a band around your legs, either above or below your knees, you are missing the bigger picture. I mean, yes, you're building a little strength around your outer hips, but you're missing a very important player in the movement chain when it comes to improving knee tracking or knee alignment. Your feet. And I have a simple exercise cue to resolve that. No band required. Now be sure to stay tuned until the end of the video, where I'll also share with you a corrective exercise that targets all the muscles along the movement chain that need to coordinate and get stronger for healthy knee alignment and pain-free motion. I'm Amanda Harris with Re-Kinect, where we help you get past your limitations or pain so you can return to the activities that really move you even after injury or surgery. So let's work on this squatting motion without a band. Now, to get started, you're welcome to use a chair if that's how you normally practice squats, but for simplicity's sake, I'm not going to use one. I do want you to take shoes and socks off because it's important that you can feel the floor. But if you have toe socks, you can certainly wear those. I just want to be sure your toes can fully spread, right? And you can feel the floor with all 10 toes. Now, before we start talking squat, just check in with your pelvis position and make sure that if you typically carry your pelvis tilted forward, you can kind of moderate that. You can let the tailbone drop down just a little bit so that your pelvis is in a more neutral position. And then I want you to put your feet shoulder width and point them relatively straight ahead. I know you might like a little bit of a toe turn out here, but let's make sure that they're still pointed more or less straight ahead. All right, now here comes the cue. You're gonna gently, and when I say gently, I mean with like 20 to 30% intensity. That would be like 2 out of 10 to 3 out of 10 level intensity. You're gonna gently roll your thigh bones away from your midline. So what I want you to see is, I'm gonna do that again. When I let my legs relax, my knees are slightly toward my midline. Hopefully you can see that in the video. And then when I gently roll my thigh bones away from my midline, the arches of my feet lift. Now I'm making sure my big toes stay on the floor here. The arches of my feet lift and my knees roll to the point where they're exactly over top of my feet. So I've just aligned my knees with my feet and my pelvic bones. So all these joints are in alignment, right? This is what you've been shooting for with that band, but you couldn't quite get it because you didn't have the foot thing. So what I want you to do is keep this gentle 2 or 3 out of 10 level effort in rotating the thighs outward, and then you're gonna practice your squatting motion. So sitting and standing or just squatting, keeping that gentle thigh rotation the entire time. Now, it does take a little practice to feel like you're really winning this, but what I want you to sense is that your feet are alive and they're working. The arches of the feet are working, the outer hips are working, so this whole movement chain is now working and keeping your knees aligned and tracking properly. So just so that you can see it from the side, I'm again standing with my feet shoulder width. I gently laterally rotate or outwardly rotate my thigh bones, and then I resume my squats. And I've got my feet very much alive here, as well as my outer hips, which is what we were really going for in the band, but we missed the foot part. Now, if you are working on knee tracking with this maneuver, you're gonna probably wanna practice this little move 10 times a day. I mean, like 10 squats or 10 sit-to-stands a day, making sure that you've got all these elements present, right? The feet are active, the hips are active, so you're keeping that little bit of rotation in the legs while you're sitting and standing. Now, if you're really weak through these muscles, then you could use the corrective exercise that I promise at the end of the video. But before I jump into that, I just want to say, if you like this, if this is helpful to you, please go ahead and hit that like button for me, and do share it with friends and family members who you think would find it helpful. I really appreciate your helping me get this out to others who could really use the information. And last but not least, if this kind of information is useful to you and you want more, be sure to click the link in the description below to save your seat for my upcoming free live webinar at the end of August. Hopefully, I will see you there. All right, let's go to the corrective exercise. So for the corrective exercise, we're going to need a wall. And what we're going to do is put your inside foot and your inside forearm against that wall with your elbow at about a right angle. And then I want you to place your outside foot under your pelvic bone. So this is my hip bone and this is my pelvic bone. So you're probably going to stand with your feet a little closer together than you would ordinarily prefer. And of course, both feet are pointed relatively straight and all 10 toes are on the floor. And what I want you to do next is with, once again, your 20 to 30% level intensity, roll your thigh bone, just the outside one this time, roll your thigh bone away from your midline enough to activate the arch of your foot and your outer hip, but keeping your big toe on the floor. So far it sounds very similar to our cues that we used in the squat, but what I'm gonna add here as part of your corrective exercise is I'm gonna ask you to push your body using your forearm and your foot away from the wall, and that's gonna put more load on this outside foot, leg, and hip. So you're going to start to feel the arch working harder, the outside hip working harder. So everything starts to work a little bit harder. Now, if this starts to hurt your knee, you got to back off a little bit. So sometimes it takes a little bit for you to kind of dial in how much intensity to use. But you're pushing yourself away from the wall, loading this movement chain, and then you can really start to see how you're going to coordinate and strengthen these muscles a little better. Now, if this feels okay, you can add some little mini squats. All right, and what you're going to do is you're going to keep this up for about 3 seconds before you relax and then do it all again. And I want you to do 3 to 5 repetitions of 3 seconds each. So 3 seconds of little mini squats or just standing still and pressing, whichever level you tolerate. You practice that 3 to 4 days a week, and in a couple of weeks you should start to see a big difference in how easy it is for you to maintain proper knee tracking in not just squats, but things like climbing stairs or practicing lunges and other exercises like that too. And that's what we're really going for, is knee alignment that carries over into other movement patterns where you can't use a band, right? Okay, so I hope you found that helpful. That's all I've got for you today. Don't forget to save your seat for the webinar. And until I see you next time, keep moving and be well.